Foad Nahai. I'm a board-certified plastic surgeon practicing in Atlanta, Georgia. I'm a professor of plastic surgery at Emory. I've had a very long career, which I have thoroughly enjoyed. I recall about 15 years ago being approached at one of our national meetings by a board member of Quad ASF who was familiar with me, was aware of my interest in patient safety and some of my writings and publications on patient safety, and said, "Foad, would you have any interest in becoming involved with Quad A?" Back then we used to call it Quad ASF. And I said, sure, if it's for patient safety, it's my passion. I was fortunate enough to immediately be voted in on the board. And very soon I became the secretary treasurer and ascended to be president, now as past president and board member. I have seen the evolution of what we now call Quad A. I've seen the evolution. Quad A was founded by plastic surgeons in the early 1980s. It was founded because, again, in the state of Florida, qualified and unqualified surgeons were doing liposuction. Liposuction was in its infancies in the early 80s. There were no regulations. A lot of these physicians operated in their own office, unaccredited facilities. Some may be in hospital settings, and there were many deaths from liposuction. Liposuction was being feared. So a group of plastic surgeons got together and said, before we are regulated, we need to come up with regulations. We need to come up with regulations, certification, accreditation of facilities where not just liposuction, but aesthetic outpatient plastic surgery can be performed safely. So those were the origins of Quad ASF. Quad ASF grew and went beyond plastic surgery to other specialties such as GI, rural health, dentistry, and many, many more. So the organization has evolved, and with it, the board has evolved. At one time, it was exclusively plastic surgeons. Now we have a very broad representation of the specialties whose facilities we accredit. We have anesthesiologists, gastroenterologists. We even have a lay board member, which I think is essential for an organization. So I've seen this organization evolve, and very happy to be part of it. Happy that 15 years ago I said, yes, I'll be glad to be involved.